All right, let's do anterior neck. This is primarily going to be the muscles and not as much the blood supply. So the first one to get out of the way is going to be platysma. When we do our dissection, we're going superficial to deep. The platysma is very small. It's like the thickness of a slice of deli meat. It is in charge of grimacing the face. It's something that's pretty tough to preserve in anatomy labs. So I don't think any of the cadaver labs are going to have uh, full extent preserved platysma. It's just too superficial, it's too thin, and most of us are already to the deeper structures. So just kind of appreciate the layers that it would occupy, where it would be just below some of that subcutaneous tissue and be the first muscular layer we go through. The other thing that's kind of important to know for it is innervated by a special thing. It's innervated by actually a cranial nerve, and it's going to be the facial nerve. So just like an anatomy lab, we're going to kind of go deep to platysma to talk about some of these other structures. Now, we're going to primarily be talking about what I call the strap muscles, going to be the suprahyoid muscles and the infrahyoid muscles. But I think we should get sternocleidomastoid out of the way. It causes a lot of confusions based upon its actions. But when talking about the way that its path, it does have a convenient name. We have the sternum, we have the clavicle, and then we have the mastoid process that it roughly attaches to. So this muscle can do a couple cool things for us when both of us activate. We can kind of see a flexion that's appreciated very well in the sagittal plane, and we can see some kind of unilateral flexion that happens in a little bit of a coronal plane. But what does it do in regards to rotation? And I like to say it makes the nose go away. So if my right sternocleidomastoid is causing rotation, my nose goes left. The reason that occurs is because we have an anchoring site anterior to the axis rotation, an anchoring site to the posterior axis, excuse me, an insertion that is posterior to the axis of rotation, and it creates a rotation that pushes the nose contralaterally to the ipsilateral activating side. Basically, think nose goes away. The other thing to note for testable tidbits on it is when we talk about layers of fascia, this and trapezius are both derived from the investing layer of fascia. This is probably why they share the same innervation, which is going to actually be a cranial nerve. So all three of those tidbits are usually tested somehow together, that it comes from investing fascia, which is the same as trapezius. They have the same innervation, and that innervation is a cranial nerve. So let's get this one out of the way and let's talk about our infrahyoid muscles first. My infrahyoid muscles are going to be four of them. It's going to be sternohyoid, sternothyroid, thyrohyoid, and omohyoid. The first three that all have hyoid and sternum in them, or thyroid and sternum in them, or thyroid and hyoid in them, we'll talk about those together. But let's do Omohyoid here. It's on the Mount Rushmore of coolest paths that muscles take, where it starts at the hyoid, which is a pretty anterior structure, and it actually terminates pretty posterior on the scapula. It's one of the muscles that we talk about attached to the scapula that you might get asked about in the OR one day under high pressure. It's the most lateral of the strap muscles. It is innervated by onsa cervicalis, which all but one of these are innervated by, and we'll talk about that later. So let's kind of get this one out of the way. So we're left with the best of the rest. I have sternohyoid, I have sternothyroid, and I have thyrohyoid. I like viewing this as a math problem here. If I have my sternum, my thyroid, and my hyoid, and I have one muscle that travels the distance between all of them, then the other two muscles must make up the sum of that difference. So what do I mean? If this is A, B, and C, well, the difference between A and C is the same as the difference of A and B and C added together. Boo, math, not fun, but it conceptually helps me remember that they're all traveling the same distance. There's just two of them that equal the length of one. So the first muscle is going to be sternum to the hyoids. The sternohyoid is the longest and most superficial of the remaining three strap muscles. It's going to exist superficial to these two muscles here, which is going to be sternothyroid and thyrohyoid. So let's see if we can show this a little bit better here. We would have trachea, we would have our lobes of the thyroid that sit there, but this is a muscle that's going to be more superficial. This one's going to be shorter and deep. This one can sometimes feel like a little bit of a muscle belly, as can this one. I usually like to say that the thyrohyoid muscle is going to be a little bit smaller and it's more of a feel it than kind of a roll as a muscle belly type of muscle there. The only thing that I want us to appreciate here is going to be a rule of exception, though, and that's going to be based upon innervation. When we talk about the four infrahyoid muscles, Three of them are innervated by ons cervicalis. One of them is not. So it's worth knowing which one is not. And that is going to be the thyrohyoid muscle. Whereas the ons cervicalis is kind of ventral roots of a couple of the cervical levels. It's going to be, I think, maybe like C1, 2, and 3. And it's kind of a collection of those ventral or motor roots that come off of them. The thyrohyoid is going to be innervated by a ventral root that comes off of C1 that paths along with the hypoglossal nerve there. So it is the rule of exceptions, and that is a testable nugget there. So it's the only infrahyoid muscle that has a different innervation. So the take-home message with those is omohyoid kind of does its own thing for pathing, and these three muscles can best be appreciated kind of together. That sternohyoid travels the same distance as sternothyroid plus thyrohyoid. And to end it off here, let's talk about the suprahyoid muscles, which I like to say there's 5 of them. We have posterior digastric, stylohyoid, anterior digastric, mylohyoid, and geniohyoid. I kind of view them into chunks where we have the 2 here, the 2 here, and the one that's deep. So the 2 that kind of sit by the ear or the edge of the mandible or angle of mandible over here is going to be posterior digastric and stylohyoid. One of the things that I see year after year in anatomy lab is people try to distinguish which one's which, because we'll see 2 muscle bellies that are sitting back there. You know, while certainly the stylohyoid we expect to path a little bit more anterior because the styloid is anterior to the mastoid, and we can expect it to have this little bifurcation around the belly of the posterior digastric. I think the easier way of distinguishing which one's which is by tracing it down to the anterior belly of the digastric. Anterior belly of the digastric is really easy to identify, and if we trace it kind of posteriorly as we go kind of under our anchoring ligamentous structure over here, and we trace it posteriorly, the one that continues as a muscle belly is going to be the one that is posterior digastric. So if I'm holding on to anterior digastric, I'm tracing it down, I feel a muscle belly that is continuing, or I'm pulling on the muscle belly over here and it's causing tension on anterior digastric, that's probably going to be the better candidate, as opposed to trying to distinguish in a poorly dissected cadaver of which structure is more anterior than the other ones. Follow the muscle belly, touch the muscle belly, and trace it down. The other kind of conceptual thing I like us to grasp in this area is that the cranial nerves are going to innervate things that are roughly in those spaces of kind of face geography. So what I mean by that is these 2, because they're pathing close together, are going to have basically the same innervation. These 2, because they're pathing together, are basically going to have the same innervation. So what I'm talking about is posterior digastric is technically innervated by the digastric branch of the facial nerve. Okay, so it's a small named branch coming off the big picture, which is facial nerve, which is going to be cranial nerve 7. Stylohyoid is going to be innervated by the stylohyoid branch coming off of facial nerve, which once again, take home point is facial nerve, cranial nerve 7. So both of the muscles on this side are going to be innervated by the nerve that roughly paths in that area, which would be facial nerve. The 2 muscles that we see anteriorly, which is going to be anterior belly of digastric, which is going to be the more cord-like muscle belly that is going to sit superficial, and mylohyoid, which is going to be the flat muscle that we can feel deep to anterior digastric, are both going to be innervated by trigeminal nerve, which is going to be cranial nerve 5, specifically V3 branch coming off of it. So the last thing I also want us to just appreciate here, is that we have one more muscle to talk about, and that's going to be geniohyoid, which is going to sit closer to the tongue or more deep as we're going from under the chin up. It's going to share an innervation with the nerve that also innervates near the tongue. So this one is going to be cranial nerve 12, which is named hypoglossal. So the nerve that innervates the tongue is going to innervate the muscle that is closest to the tongue. So when we go back to the suprahyoid muscles, I just like the take-home message to be of think of them in cranial nerve pairings. The ones on this side and this side, by where the pointy parts of my mandible are both going to be cranial nerve 7. And the one that occupies the middle, so the 2 muscles there, anterior digastric and mylohyoid, are going to be innervated by cranial nerve 5, specifically V3. And then the muscle that is closest to my tongue down there, the base of my tongue, is going to be innervated by the same thing that innervates my tongue. So that's it.